March is Multiple Sclerosis Awareness Month. It's an autoimmune disease that affects about 1 million people in the U.S., including celebrities like Christina Applegate, you might know, and Selma Blair. But many people still have a lot of questions about the chronic condition. Dr. Wled Wazni, head of the stroke program at Dignity Health St. Mary's Hospital and Glendale Memorial Hospital, joins us live to demystify MS. Dr. Wazni, thank you so much for being with us. First off, let's give a brief explanation of what exactly multiple sclerosis is and how does it impact a patient.
Yeah, well, multiple sclerosis is a genetic disease that is an autoimmune disease. And what it does is your body makes antibodies that affect the neurons in the brain. So what it does is it attacks the myelin sheath, or the covering around the neurons, which interrupts the signal between the brain and the rest of the body.
Okay. Is it considered terminal?
No, it's not considered terminal. It is considered something that you'll need to take medications for. That we have medications now that are what we call disease modifying. So what that does is it helps negate some of those antibodies so that you can live a normal life.
Okay. So what are the risk factors for developing it? I know you mentioned that it's a genetic predisposition, but what are the risk factors and how might you recognize it?
Yeah, I mean, the risk factors are genetic, and there's not really many risk factors that you can have besides other autoimmune disorders. So if you're known to have other autoimmune disorders, then you are at a higher risk for multiple sclerosis. Some of the people who have a history of maybe one side has blurriness have a risk of developing MS. And some of the signs and symptoms of MS are weakness on one side, unexplained weakness, numbness, blurry vision, or changes in your cognitive ability. And what we can do is we can diagnose MS by using a brain scan or an MRI to detect what we call MS plaques. That's diagnostic or pathognomonic of the disease.
Ah. So in recent years, I'm sure you know that multiple celebrities, they've opened up about living with MS. So what is the impact of that increased awareness?
Yeah, so I think the impact of the disease is, recognizing the signs and symptoms so that you can get treatment early. Because we do have advanced medications now, and a lot of them are very effective at modifying the disease progression. So if you're diagnosed early and you get on these medications early, then you can really significantly decrease the morbidity of the illness and reduce what we call MS flare-ups, and actually, tapering the disease so that it doesn't affect your life.
Okay. Where can people go for help with this?
Yeah, so the one person that treats multiple sclerosis are neurologists. So I would seek neurologists, and a lot of neurologists these days have a specialty training called the fellowship. That actually that's all they see. So if you do get diagnosed with MS, I'd recommend seeing a neurologist who specializes in multiple sclerosis.
Okay, very good. Thank you so much for giving us that important information, Dr. Wled Wazni. We appreciate it. Have a good day.
Thank you. You too.